is Lindsay Sullivan, and welcome back to our monthly Facebook Live series with our physicians and providers here at Bone and Joint Institute. This month is National Osteoporosis Month, so today we have Jared Vaughn is talking to us about osteoporosis. So, Jared, before we kind of get started into osteoporosis, tell us a little bit about yourself.
So I'm Jared. I'm a physician assistant here, also known as a PA. I've worked here a long time. I've been here for 12 years. I've been a PA for 17 years. And I worked in family practice for the first 5 years of my career. And then I've been here for 12 years doing lots of different things. I do osteoporosis management now. I do sports medicine. I do urgent care, fracture care, and injections, and just kind of anything they ask me to do.
Yeah.
That's right. Yeah.
Well, speaking of osteoporosis, let's talk about that today and kind of dive in a little bit. So tell us what is osteoporosis and who does it most commonly affect?
So osteoporosis is a very common, actually, bone disease where your bones become brittle and they become weak. It affects over 50 million Americans. And it's a very underdiagnosed problem. People don't know that they have osteoporosis until they break a bone because of the osteoporosis. So you can't feel osteoporosis. You don't know that you have it unless you've had a bone density test or unless you've broken a bone in a way that doesn't really make sense, that bones shouldn't break. For example, if you fall from a standing height and break your hip, that shouldn't happen unless you have poor bone quality. So it's a process by which the bone is brittle and weak and can cause some major issues.
Major issues.
Mm-hmm.
So what population does it most commonly affect?
So it most commonly is in postmenopausal women, but also occurs in men and even in premenopausal women. In general, we think of this being mostly a disease that causes problems after your 50s and 60s. And so we normally recommend screening for that just routinely for women over the age of 65 and men over the age of 70 or over the age of 50 if you break a bone that shouldn't be broken. Mm-hmm.
So you mentioned fractures as kind of one of the most common injuries. Are fractures mainly the injury that happens with osteoporosis,
Mm-hmm.
or are there any other injuries people need to be aware of?
So fractures are really the only issue that happens with it. And I should mention there's a lot of confusion often about what is a fracture. People often think a broken bone and a fracture are different things, mm-hmm. but they're actually the exact same thing. So a fracture is just the medical term we use to say that you broke a bone. So just so that that's understood.
Absolutely.
Because that's a frequently misunderstood thing.
Absolutely. So talk about how can now that we know that someone has osteoporosis via the fracture or a test, how is it treated, or what treatment options are there available, and what do we offer here as far as treatment options?
So, as I mentioned earlier, which maybe we should step back to this, in order to know that you have osteoporosis, you either have to have a bone density test, so that's kind of how we find out that you have it. Then that's a simple x-ray test. We do that on campus here at Williamson Medical Center. It's not painful, it doesn't take long at all. And that tells us how dense your bone is, or how essentially strong your bone is. And certain levels of that mean that if it's too weak, that you'd need to have help with that. Also, if you break a bone, a hip, shoulder, wrist, pelvis, back, from just a fall from a standing height, that gives you a diagnosis of osteoporosis, whether you have those other tests or not. So once we have that diagnosis, there's multiple treatment options available, and we do almost all of those here at Bone and Joint. So do you want to know more about the types of treatment options?
Sure, let's talk about it.
So there are treatment options in terms of pills that you can take at home. There are injections that we give here in the office. One of those is an every 6-month injection. One is a once-a-month injection for a year. And there's also self-injections that can be given at home. There's an IV infusion. Now, that's not something we do here at this building, but we can set it up at other buildings for you. And there's a lot of different options for osteoporosis treatment. It really comes down, here at Bone and Joint, we do an individualized approach. So every person's going to have a different it's not a same treatment for everybody. Yeah, we got to kind of look at your whole picture, look at some lab work, look at your health history, and what we think might do best to kind of help your bone quality.
Which is extremely important for the patients. And that's one thing that we do at Bone and Joint overall is really have that personalized care. So thank you for that. How do you prevent osteoporosis?
So osteoporosis is a disease that can be caused by lots of things. There's a highly genetic component. Often people that have osteoporosis have a parent that has or had osteoporosis. So you can't prevent that part of that at all. But there's also many medical conditions that can contribute, things like thyroid problems, diabetes, problems with being able to absorb food. For example, if you had a gastric bypass surgery or celiac disease. So those are all things that can cause it. So managing those problems appropriately is number one most important. Now, assuming that those things aren't there, the things that we always recommend are adequate calcium and vitamin D intake, regular weight-bearing exercise. So Lindsay, that means things where you're actually doing resistance exercise, whether that's standing and walking or resistance bands or weights. Those things build muscle, they help build bone, and they help protect your bone if you fall so that you don't break your bone. And then lastly, moderation of alcohol and not smoking. So smoking decreases your bone density by about 5 to 10%. So stopping, that's a lot, okay? So when we're doing medicine to build back your bone density, we're usually only getting it 10% or less better. And so we can just get rid of that with not smoking. So that's one of the best things that people have any control over that they can do. And then moderating drinking to less than a couple of drinks a day.
And all of those things are great for overall health in general. So that's very important, not only for your bone health, but just overall. So, well, Jared, we end every Facebook Live with talking about the comprehensiveness. And I think you've really taken a dive into how we can affect the patient from the osteoporosis side. But talk about the practice as a whole and how all of these things build into the comprehensive care that we offer here at Bone and Joint.
So this is a good thing, but it's also kind of a bad thing for the patient because if you break your hip, we're here to fix it. So if you break your back, we can help with that. So comprehensive-wise, the way that patients often come to me for osteoporosis is because they've broken a bone. And one of our providers or the patient might say, is this normal? Should I have broken this bone? I just had a small tumble, and why would I break something? So that's when that kind of initiates the process of us kind of looking through that. So that's a good part of what we do here. We work together. Our providers get in touch with me or Dr. Gibson, who's our other osteoporosis provider here, and we get the patient the proper blood work and bone density scans, and then we get them set up with treatment. So, we do our blood work here at Williamson Medical Center. We do our bone density scans here at Williamson Medical Center. So that's all kind of in-house, and we can take care of all of that here. And then we, when we do have problems with broken bones, we refer to our surgical colleagues or even our non-surgical colleagues when it's not appropriate for that. So that's one of the kind of comprehensive ways that we're able to help. And we also provide all of these osteoporosis treatments here on site, with the exception of that infusion. These medicines can be very expensive, and they're normally covered by insurance. That's a process we always go through before we start you on that medicine. But most family practice doctors don't have access to all of the medicines that we do here because they don't keep them on hand because they don't see enough of them.
Right.
So we do offer those services that often aren't offered at local primary care doctors' offices.
Okay. Well, awesome. And then if somebody did have an injury, we do have the physical therapy, occupational therapy as well, and then our orthopedic urgent cares and physical therapy around the area. So like Jared said, it kind of goes all into the comprehensiveness of Bone and Joint as a whole, and then our partnership with Williamson Medical Center as well.
And physical therapy is a great thing. Thank you for saying that. That is very helpful oftentimes because as we talk about fall prevention, many times, I can help with the bone density to help your bone be better so that you're less likely to break bones and have major problems that come with that. Also, not falling helps you not break bones. And so we do things that comes into the regular exercise. We sometimes will have you see our therapy team for fall prevention, kind of treatment to help you with balance or that sort of thing. So yeah, we do integrate with them as well.
Awesome. Well, Jared, thank you again for your time and during the lunch hour. We really appreciate it. And just kind of diving into osteoporosis as a whole during Osteoporosis Month.
That's the right time to do it.
It's the right time to do it, absolutely. Well, if you have any questions or want to schedule an appointment with Jared, you can check out our website at boneandjointtn.org or give us a call at 615-791-2630. So, Jared, thank you again for your time today, and we'll see you next month. Thank you.
Thanks.